The need in the community for mental health services is at an all-time high. So we're seeing huge spikes: depression, anxiety, trauma, and all of those things are within the purview of the Center for Community Mental Health, where there is evidence-based treatments that can help people feel better. And that's our goal, is to both train our behavioral health trainees in those evidence-based services, as well as provide those critical needed services to our community. We provide therapy support, testing support, emotional support, to the community at large, not just our Mason students. Fortunately, we have a lot of support from our community that allows us to use this sliding scale. Some clients are paying $5 for a therapy session. We really don't want finances to be a barrier. And in this area in particular, that is a barrier to mental health treatment for many people. Over the years, we've developed 3 different courses that involve our undergrads. The undergrads come and they are actually working at the center. They get to learn the behind the scenes of a community mental health center. They also get to learn about testing materials, which undergraduates rarely get a chance to put their hands on testing materials. It's really an opportunity for undergrads to get practical real-life experience in the field of psychology, which can be really difficult. We have 2 what we call emotional support warm lines, one in English and one in Spanish. They're staffed by advanced undergrads who have been trained very intensively, supervised by doctoral students and the licensed folks. In this way, we're combining that training with making sure that help is available for the community. For people who need more than just emotional support when they call in on the line, our second step is a 3-session skills-based intervention. There's no wait list for those, and that's really important to us, is that's kind of to bridge while you're waiting or finding other services. One of the other services we offer is psychoeducational and psychosocial testing. And most people think of this as testing for kids for learning disabilities, ADHD, emotional issues that may interfere with school. But we also test college students, young adults, older adults, so that they can get some clarity on what may be getting in the way of their functioning. That often leads to an individualized education plan. The schools work with us very closely, because if you know what's going on, it's a lot easier for us to make recommendations and for you to make adjustments to how you're studying. What do you need to be successful? And then we have a special place in our heart for veterans. We partner with a lot of legal firms to help veterans who have had potentially incorrect discharges from the military. The effect of that is that they don't have the benefits to get treatment that they would if they had been correctly diagnosed with PTSD. And so we actually partner with the law firms to do a full comprehensive evaluation, and then we share those reports with the legal firms, who then will apply for either discharge upgrades or benefit upgrades for the veteran. And that has been an incredibly rewarding partnership. Our students see immediate effects, that they're actually making a real difference in the lives of these veterans. We all work and function and live within a system. And so these partnerships are critical. We're always trying to figure out what are some of those community needs, match them with some of the training needs to develop this win-win, where not only are we training that next generation of behavioral health providers, but also training them in a way that they will then give back to the community throughout their careers as well.